CEO here. Just want to say hello. How you doing?
Dialogue is the oxygen of change. And if we're going to transform into this incredible academic health system, that we really need to take time to understand and really engage in meaningful dialogue. Hello, I'm Rick Lofgren, President and CEO of OU Health. I couldn't be more excited about joining the OU Health team and what we're going to be able to accomplish together. I have had an opportunity my first couple days to go around and meet several people in the organization. And I've been incredibly impressed about the consistency and the passion. People are really committed to this organization. They're committed to making a difference in their community. They're committed to their patients. And that's palpable when you talk to them any corner in the organization.
Yeah, good day.
I have incredible confidence that OU Health is going to continue what it's done in the past and then so much more as we impact all the healthcare in Oklahoma. Through most of my career, I've actually been a primary care practicing general internist and really had the opportunity to take care of patients and really understand the impact of disease. Creating an integrated healthcare delivery system isn't really optional. It's really necessary to be able to put together the resources and to leverage all the assets so you really have the biggest impact in affecting all the care and the health of all of Oklahoma. It's really to be able to deliver on what I think is the academic health system promise. There are things that only an academic health system can do in impacting the health of our community. One of the things that we have both, I think, a responsibility, obligation, and opportunity is bringing life-altering care or destination programs to our community. These are services that actually requires an academic ecosystem. It requires teams of subspecialists working together, thinking about new and innovative ways today to impact patient care. And in order to do that, they need to be surrounded by people who are thinking about translational research. And those individuals need to be surrounded by people who are thinking about the basic science and new learners thinking about new questions that really drives that environment. So to bring these kind of special programs to our community, it requires that academic health system and that ecosystem along the way. And then in turn, we have the opportunity as the flagship academic health system to impact the delivery of care throughout the entire state. How do we support other hospitals so that they improve their both capability and accessibility to care so that we reach every corner of Oklahoma and beyond? That's what I see as the future for us. I think it's both a responsibility and the covenant that we have with our community. This next step of creating an integrated system is just the next evolution that's essential so that we really can live into our full responsibilities and aspirations. I think that's critically important as we build the culture, and that's the second thing that I think will be important, is really creating the importance of the OU Health way, that we come together and value the systemness and recognize that healthcare now is a team sport, that it really requires us working in concert in a way and to really around the needs of our patients to drive the best outcomes every time. The other thing that I think then is closely important to that is focusing on the experience. The experience that our patients have, their families have, our referring physicians have, and maybe even equally importantly, that each of us have in the workplace so that we feel happy and satisfied in the things we're able to accomplish. But I do know that things that I want to make sure that we focus on is the people. That really it's the people and the culture that's really going to drive our success.